I'm Lindsay. I'm an emergency medicine and clinical pharmacist, and let's talk about when you make a mistake as a pharmacist. It's going to happen. No one is above making a mistake. Everyone will mess up at some point in their career. You just hope that it's not a life-threatening mistake. Every time there's something that happens, you have to report it. Every system usually has like a non-punitive way of reporting things because a mistake is usually the result of a process failure. And that process needs to be fixed. Other people don't make the same mistake, you know? But if the mistake does affect patient care, it's important to let the physician know, like, hey, I accidentally did this, I'm sorry, we can fix it with this, this, and this, or this is how I've already taken the steps to fix it. And then telling your boss, because once it's written up, they're gonna see it anyway. So you may as well just tell them, like, hey, I did this, I'm sorry, this is what I need to do to prevent it from happening again. What else can I learn? Healthcare professionals are human. Obviously, there are massive mistakes that are made that affect patient care. That's why I think it's so important, and this is what I tell new pharmacists. If you are doubting anything at all, look it up and then ask someone. If you have a gut feeling that like something is just not right, look it up. Don't ever click verify without looking everything up and feeling confident that when this patient gets medication, it will be safe. I've had people laugh at me for looking certain things up. I've had people laugh at me for asking them dumb questions because to them it was dumb. But for me, there was a gut feeling like I just need this double checked. And you know what? That is fine. You will only ever feel embarrassed if the patient gets hurt because you didn't ask a question. I look up every single pediatric dose. Even if I know it for a fact that I know the dose is correct, I look it up. Meds that I don't use often, I look up. Every medication that is immediately life-saving, like an EpiPen or pressors, are always available in some way to override or pull out of the Omnicell or Pyxis without a pharmacist approval. Taking an extra 2 to 5 to 10 minutes to make sure that another medication like an antibiotic or blood pressure medication is correct on a patient is worth that 10 minutes. Giving a patient an antibiotic that their bacteria is resistant to is not treating them. That is harm. Taking an extra 5 minutes to check their cultures, check the bug coverage, is going to help your patient. If someone's going to make fun of you for looking something up, ignore it. You don't want them even in your life anyway. Take the 5 minutes, look something up. You will never forget the first mistake you make.